I went to the farmer's market on a Saturday on May 2010. The pain was shooting. I couldn't stand, I couldn't sit, I couldn't walk, and I had to immediately sit down somewhere, relax it for some time, went back to my car and went back home and just lied down. So it was so bad. And then I think so that was a Saturday, and a Monday I went and saw my family physician, and that Wednesday I saw Dr. Manning, and then within a week we went into a surgery.
Jiggs is a guy when he was in his early 40s when he came to me, and Jiggs had presented with a condition we call an isthmic spondylolisthesis, also known as a slipped disc.
Dr. Manning took some pictures, he took an x-ray, we did an MRI, that was on a Wednesday, and he immediately looked at those pictures and he showed me what exactly was wrong with my spine.
And this can be a chronic condition, but superimposed on this with Jiggs was an acute disc herniation, which was causing him bad left leg pain and also some weakness. When you're in your early 40s and you're faced with the prospect of significant back surgery, then it takes a while to wrap your head around why you need to have this done and what are your other options if there are other options.
The biggest fright was for me is, doing some surgery on the spine, whether I'm going to be alive after the surgery or not. So that was my biggest fear.
With Jiggs, we moved pretty quickly to an operation, and that operation was an L5 to S1 decompression infusion, which treated not only the disc herniation, but the underlying condition of a spondylolisthesis, or slipped vertebrae.
I don't have lower back pains anymore now, so I'm very much pretty into my active lifestyle. I go to the gym 3 or 4 times a week. I ski, and in fact I was operated in May 2010, and December 2010 I was skiing on the slopes of Bogus, so that was pretty impressive.
Jiggs did tremendously well with the operation. Jiggs is now a guy that I see more at the gym, and I see him at the mountain up at Bogus Basin skiing. I don't see Jiggs in the office much anymore. He's doing that well. We periodically check in.
I would recommend Dr. Manning anytime. In fact, if anybody asks me for any good neurosurgeon, I would always recommend Dr. Manning.